Hello and welcome to Joy in Our Town. I'm Sherry Duckworth, and joining me today is Miss LaToya Stewart, Director of Community Health for the Concilio. Thank you so much for coming and talking with us, LaToya. It's nice to have you.
Thank you for having me here.
Can you give us a little background on what you do for the Concilio?
Yeah, absolutely. The Concilio is a nonprofit organization in Dallas. We've been around since 1981.
That's great.
We were initially formed to address the needs of the growing Hispanic population in North Texas. And over time, our role has certainly expanded to include direct services, providing direct services for the community, particularly vulnerable populations in North Texas. So my role there is to focus on our health initiatives. We offer both education programs and health programs. All of our programs really speak to our mission, which is to build stronger communities by empowering parents to improve both health and education of their families. We understand that parents really are the gateway to households, the decision makers, and so that really is our starting point. So I'm really privileged to work on the health side of our organization and developing programs to improve a healthy community.
It's wonderful. Thank you so much for what obviously the Concilio does, but also for what you're doing for the community.
Thank you.
Because that is a huge need that's being met and addressed, and it is a very big challenge.
Right.
So we just thank you for meeting that challenge,
Thank you.
and really rising to the occasion. That's a big one that you have. So thank you. Health issues most prevalent or that most negatively affect the minority population in the North Dallas area, or the North Texas area, I should say. Can you kind of give us a little rundown of what you see in the community that you work with directly?
Sure. I would say that we know some populations are just have a higher risk of developing and dying from certain diseases. Some of those disparate health issues, if you will, include infant mortality, the death of an infant before the age of 1. Then there's HIV and sexually transmitted diseases and certain cancers. In North Texas, as it relates to the Hispanic population, that population is certainly more at risk or experience higher rates of what we call preventable chronic diseases or even preventable hospitalizations. And then there's the issue of obesity that really impacts the Hispanic population. If we were to look at some data just from our state, data indicates that in 2010 in the Dallas area, 72% of Hispanics were at risk of being obese or overweight. And that also trickles down to children. For 1 in 7 kids who are low income are also obese. And so that's a really significant issue impacting minority populations, particularly the Hispanic Latino population in North Texas.
I think the word that stood out to me the most is that you said preventable diseases, preventable hospital stays,
Right.
which means obviously these are things that can be avoided if different choices obviously are made in the population. How do you encourage those that you work with to help put some of these better choices in place in their life and help them to see the choices that they're making, could cost them to actually be one of the numbers that ends up being in the hospital or dying of a preventable disease?
Right. I think you raise a good point about choices and being able to make healthy choices around lifestyle, nutrition, physical activity. We offer a number of programs at the Concilio that help individuals manage diabetes and then also to help reduce their risk of developing these preventable chronic diseases, specifically managing weight and obesity. And so one program in particular that we offer is called Healthy Kids, Healthy Families. It really is one of our signature programs in the community. It's a unique platform in that it allows us to engage both parents and their children simultaneously in the program. The parents and kids go through a series of classes for 7 weeks that talk about everything from the foundation of a healthy family and how decisions are made that impact the lifestyle of your family around health and nutrition. Of course, the importance of physical activity and eating healthy. And then after they complete 7 weeks of classes, they actually engage in 3 months of exercise, whether that's walking groups or fun family activities that they do together. All of our families set what is called a healthy family goal or action plan that they kind of rally around together. And that program has been really successful. At the end of the program, we follow up with each of our families, our staff. They go in and do home visits, and to see the families excited to show you, see, we have fruit on our dining table. We're eating more fruit. I mean, it's really a tremendous program. And that's just one example of things that we're doing at the Concilio to address this.
That sounds actually fun. And as a parent, I'm like, I want to do that with my kids. You know, it sounds like something that would be really helpful to a parent, new parents, you know, people who are just struggling with some of the cultural, you know, choices that we make, habits that we have from, you know, that have been passed down from generation to generation. It kind of helps to break up the way that we think about things to have programs like this available.
Absolutely.
For those who are watching today and, you know, maybe feel the same way I do and think, you know, I think I want to try that. How can they get in touch with you? And do they have to qualify for anything in particular in order to be part of these programs?
That's a great question. One of the amazing things about the programs that we offer at the Concilio is that they're free. So families are able to participate in the programs free of charge. One of the things that is important for us and that we are targeting are families who are at risk for developing chronic disease. And so at least one member of the family has to be obese or overweight to participate in the program, but otherwise the program is available to individuals who live in the North Texas area. If someone was interested in learning more about where the programs are being offered, or even if they were interested in having the program offered maybe at their church or at their school, they could go to our website, www.theconcilio.org, or they could call our office at 214-818-0481.
Awesome. And of course, they've displayed that for us too. So hopefully people will call the number or check out the website and see what you offer. And just to give us a little rundown of some of the other things that the Concilio does for the community when it comes to the health issues, how people, I guess what people can expect, especially with how you target and help minority groups. Can you kind of help us understand how that works out?
Absolutely. I think what is very unique about all of the programs that we offer is that we utilize community health workers or lay promotoras who are really individuals from the community. So there's this idea of peer-to-peer learning and teaching and training. Oftentimes, you brought up the idea of cultural relevance. It's really important that the message comes from someone that the community is connected to, so that the message resonates. And so that is intrinsic of all of the programs that we offer. In addition to the program that I described, we also offer free health screenings for cholesterol and glucose and body mass index, so that if someone was interested in having screenings done, they could participate in some of our programs, and those screenings are made available that way. In addition to screenings, we also do a number of community events. We're always in the community, really sharing health messages and critical health messages, linking individuals to the help that they need. We know that with a lot of vulnerable populations, one of the barriers to care is lack of insurance or lack of to access. And so the Concilio is really good at linking individuals to providers and healthcare physicians who could provide that care for them.
I think it's great when you talk about having someone in the community help someone else. So, you know, Hispanic man to help another Hispanic man. I know growing up in the Hispanic community myself, that this is something that you really see a lot, is that they might not listen to somebody who they think, well, they don't really get where we are coming from or how I grew up, or this is just how we do it, right? And so if they see someone else that they admire or look up to doing it, just like with anyone else, they're more likely to follow, their lead. So I think it's really great that you all really, do kind of like a mentorship type of program there.
Absolutely.
I think that's really helpful. And you mentioned health screenings, obviously, that are available, which is great because there is a lot of issues with, access to insurance and, getting proper health care. What are some of the main diseases that you really see affected when you're doing these health screenings?
So our screenings that are inclusive of blood glucose, cholesterol, blood pressure, body mass index, they really are indicators of when being at risk for a disease. By offering these screenings, it allows us to identify those particular individuals and then link them to the appropriate care. We don't diagnose the diseases because we're not a healthcare provider, but it is a good starting point, especially to your point about individuals or for individuals who may not otherwise ever have access to any type of care.
And there is a fear, obviously, of just going to the doctor. So if this isn't technically the doctor's office, getting a health screening might not be as scary as actually going to the physician. So it's a start for them.
Absolutely.
Yeah. And I say that of experience because there is that whole, well, if I don't go, then I don't have it. It's like a superstitious kind of thing.
Correct. A very common myth, what we consider a health myth, that if I don't go, then it doesn't exist. But the other side of that coin is that when you have community health workers and individuals from the community that are walking you through the process, it certainly takes some of that fear out of the process. And so we've seen some success in that. We've been able to reach, in our programs, hundreds of individuals, parents and children. I know just through our Healthy Kids, Healthy Families program, this year we're aiming to reach over 700 parents and children through that one program.
What would you say is unique about your Healthy Kids, Healthy Families program?
I would say one of the unique factors is that, as I mentioned earlier, it really is an engagement of both parents and children simultaneously. So to see families come together to the classes to get that critical information, to see dads engaged in the process and children helping to prepare meals and knowing what's healthy and to serve those meals for their parents. It provides another opportunity for parents to make their children proud and then for children to make their parents proud. I think another wonderful, unique a characteristic of our program is that it is a long-term commitment. So you have the 7 weeks of sessions followed by 12 weeks of exercise and family physical activity. The idea is to generate long-lasting changes in these families, to really move them from the point of what I call awareness to action. I think we all know the right things to eat or things that we should avoid, but it's another thing to put that into practice. And so what this program really allows our families to do and participants to do is to put these lessons into practice over an extended period of time, ultimately changing their actual behaviors.
Well, it changes their normal. It becomes a new normal,
Absolutely.
A new lifestyle, and it changes some of those habits maybe that they've picked up over the years or, through their family ties and so forth. So I think what you're doing is wonderful and so helpful. I think it's great that you hold their hands, these families, through the process for a long period of time. So I just want to thank you for coming, LaToya, and for the Concilio again for what they're doing to help and reach out to the community when it comes to their health issues. So thank you.
Thank you.
And thank you all today for watching Joy in Our Town.